My name is Fraser, and I'm an associate professor in cardiovascular science here in the Faculty of Medicine, and I'm a professor at Memorial University. My lab is focused on studying microvascular blood flow and blood flow regulation in skeletal muscle. And the reason that's important is because all of the materials that need to get to cells in your body are transported by the blood, and they're delivered to cells via passive diffusion. So there has to be a regulatory system in order to distribute blood flow to where it's needed, and that's a dynamic process because cellular metabolism can change over time. Like if you are exercising or if you're sleeping, the demands of cells vary over the period of the day and depending on what you're doing. Skeletal muscle microvasculature is very reactive because of the oxygen demands that are necessary during exercise. So blood flow can increase up to 50-fold, and we kind of perturb that system and provoke those responses in order to study the underlying mechanisms that govern blood flow regulation in the body. Vessels that we study primarily are called capillaries, and capillaries are the smallest blood vessels in our bodies, about 4 to 6 microns, or approximately 1/20th the diameter of a human hair. Those blood vessels, you can see individual red cells flowing through these tiny, tiny little vessels. And that's really the interface between what's being carried in your blood and what needs to be transported to cells. Things like oxygen, carbon dioxide, waste products that are being removed, as well as nutrients that are being supplied to cells, hormones, drugs, anything that's being carried in the blood. There's a few things that make our research really innovative. We use pretty advanced imaging techniques to try to visualize the microcirculation and make measurements from capillaries. Most labs or most groups don't really image thick tissues because of the difficulty. You need really intense light sources and very sensitive cameras in order to see anything. And so that's sort of our analysis, and our techniques are very innovative and unique in that side. And then we also use sort of physical principles and engineering approaches to develop novel devices in order to interact with the microcirculation and the tissue microenvironment in sort of a unique and different way. And one of those tools that we use is called a microfluidic device. And over the years, we've developed a few different microfluidic devices, both gas-based and liquid-based microfluidic devices. And what that allows us to do is to manipulate gas concentrations in skeletal muscle tissue dynamically, and then also deliver drugs to micro-scale regions and really spatially constrain and focus our perturbations just to a very small region of the microcirculation in order to study the responses. Health innovation means looking at problems from a different perspective and finding novel solutions to a research question or a problem that can't be addressed any other way and can't be addressed with existing technologies. So I think that's something we really focus on in this lab. We feel like we're lateral thinkers. We try to approach problems and look at it from all different angles. And we're often facing problems that have never been addressed before, and so we're trying to develop new technologies in order to address that in a research environment at least. Combining technology and sort of our nimble minds and our intuition about how to tackle problems is really essential in order to tackle emerging health problems like that we're seeing in the pandemic, but also problems that have been with us for a very long time, like type 2 diabetes. And we study type 2 diabetes in our lab, and we've known about type 2 diabetes for a long time. We understand that it causes vascular problems, but the underlying mechanisms of those problems are not really fully understood. And so, looking at these problems with fresh eyes, with new technology, and in sort of different ways than have traditionally been addressed really gives us an edge in terms of innovation and coming up with novel solutions. I'm always looking for collaborators, especially in the areas of exercise physiology, blood flow, and tissue metabolism, skeletal muscle metabolism. Those are kind of the areas that really strongly overlap with our research program, and possibly areas that we don't have a lot of experience with. So we're experts in measuring microvascular blood flow, and especially in capillaries, but we're not experts in some of these other areas that are relevant to a lot of other fields, and also relevant to the health profession in general. So interfacing with collaborators that complement and contrast with our own work really provides an opportunity to advance our research and theirs as well.